All right, good day. My name is Bill Kleiby. I'm a gynecologic oncologist at Mayo Clinic in Rochester, Minnesota. I'm going to talk to you today about ovarian cancer. And I'll start with first asking, what is ovarian cancer? It's a lot of different diseases. The form I'm going to talk about today is what's known as epithelial ovarian cancer. It's the most common form. It typically occurs in women between the ages of 50 and 70 years old, although certainly there's younger and older that get this disease. It's invasive, and it commonly, at the initial diagnosis, when it's first noticed, has spread throughout the abdominal cavity. Now, for the purposes of this little discussion, we'll call ovarian cancer something that may have started in the ovary, in the fallopian tube, or the peritoneal cavity, called primary peritoneal cancer. We'll call all three of those ovarian cancer. They tend to behave the same. We treat them the same, although there are subtle differences, but not important for this talk. Typical for any of these forms of ovarian cancer are that the symptoms are quite vague. They sneak up on a person. Maybe it's a little bit of abdominal bloating, maybe some cramping or difficult eating, but they go on for many months until finally it reaches a point where the symptoms are enough to bring a patient to a doctor's office for evaluation. Ultimately, a suspicion is made based on some imaging, and that might be an ultrasound of the ovary, it might be a CAT scan of the abdomen, but something is made or found on these tests that makes it suspicious for an ovarian cancer. At that point, it's important that a patient be evaluated by a gynecologic oncologist, someone who is skilled and trained to treat ovarian cancer specifically. It's important to understand the rationale for how we treat ovarian cancer. Most patients, as I said, will present or show up to the doctor's office with disease spread throughout the abdominal cavity. So in those patients then, the next question is it ovarian cancer, and how do we best treat it? We feel at Mayo Clinic the best treatment is a primary or first operation to try to remove as much tumor as possible, and then followed with chemotherapy. All patients need a combination of surgery and chemotherapy in most cases. If a patient has disease that is spread throughout the abdomen, we feel that if we remove all of that tumor, a process we call debulking surgery or cytoreductive surgery, you may see it called, is beneficial by removing the bulk of the tumor and then finishing up with chemotherapy that might go on for 4 months after surgery. There's a variety of ways to give chemotherapy, and there's different drugs that we use, and that will depend on the specific patient and what the diagnosis is. But that's the rationale for first surgery in advanced stage disease. Occasionally, we'll find a patient with a disease that is confined just to the ovary, so it has not spread yet, at least that we can see. There may be microscopic spread, however, and if there is, we'll want to know that so that we can treat it more effectively. So in those patients, we do a smaller operation, but the operation is focused on what we call staging, meaning detecting if it's been spread throughout the abdominal cavity. We remove lymph nodes. We do a great number of biopsies in the abdominal cavity, as well as removing the ovaries. Once the surgery is done, then we allow the patient to recover, and usually that's in the hospital for a major operation for 4 to 5 days, and then we'll begin chemotherapy 2 to 3 weeks after surgery. Along with that initiation or starting of chemotherapy, we'll also do genetic testing on the patient to be sure and to identify if that patient happens to carry a gene that puts her at risk for developing ovarian cancer. Some women, their families have a lot of breast cancer and ovarian cancer, and that is a genetic disease. For those women who do inherit that abnormal gene, and it's a minority of patients, but for those women that do, it's quite important to identify them because their family members are at higher risk as well, and they can take preventative steps to reduce their risk of ovarian cancer. After surgery and chemotherapy, most patients will go into remission, and remission can last a variable amount of time. Some patients will be cured, but some patients will have their cancer come back. We then discuss other options for treatment, including sometimes repeat surgery or repeat chemotherapy to treat recurrent disease. We're available here at Mayo Clinic at any time for consultation and to evaluate patients that are suspected to have ovarian cancer or suspected of having recurrence of their ovarian cancer. And further information is available at our website, which is www.mayoclinic.org. Thank you for your attention today. I hope you found this information useful.